Knowing if your water broke seems really obvious to me. Why are people saying that it could be confusing? I mean, that doesn't seem like it'll be confusing at all. Let's talk about it. I'm Hillary, I am the pregnancy nurse, and I'm the curly head behind the website Pulling Curls, where we aim to educate moms from bump to bassinet about having a confident, collaborative hospital delivery that they are looking for. I am also the creator of the online prenatal class for couples. I have been a nurse since 1997, and I have 20 years of bedside labor and delivery experience. Today we are talking about your amniotic sac and your water breaking. If you're interested in stuff like that, go ahead and click that like button because it really helps show YouTube what you're interested in, which is learning more about your delivery. I can't wait to talk about it. Okay, so what is the amniotic sac? It is a sac that goes between your, you know what, let me just get one. It is a sac that goes between your uterus, this is your uterus, these are your fallopian tubes, and the baby. So I hope nobody goes in and pulls your baby out this way, but as we see here, babies can be born with the sac around them. That's called en col, I believe, which I think means for something in French. So it is just a bag of water that holds, the placenta is usually inside of it, that is around your baby in the womb. So it's just like this. You got to picture the baby is inside the uterus in this little sac, and it is full of water. Now, of course, I wouldn't want to get my little crocheted baby full of water, but you got to envision it's full of water. And then, you know, as it breaks, then the water comes out. That's what your amniotic sac is. Now, what is the fluid in there? It is mostly baby pee, which is probably not what you want to hear, but you have to remember that urine itself is actually sterile while it's in your bladder. It's only when it comes out and like touches all the other things that it's really a problem. So most of the amniotic fluid is baby pee, and if you've ever seen a new baby, you know that they pee all the time. So that's how it kind of replenishes itself while they're in the womb. Your uterus and the placenta do make a small amount of amniotic fluid, but most of it is created by the baby as you get further into your pregnancy. Okay, and before we get into this, definitely stay tuned because at the end of this video, I'm going to give you a few tips as you're getting towards the end of your pregnancy for, you know, possible water breaking. So, how do you know if your water broke? Well, first off, the main thing to know is that it is usually not a one-time gush. You need to think, here's our little baby, their water's broken, but they are still peeing, right? So water just keeps coming out. But as you can imagine that when you break the water, a fair amount comes out. Now you also need to think that it depends on if the water breaks down here, but if it breaks up here, you're only gonna get those little sloshovers. So it doesn't mean that you're gonna have a giant gush of fluid. You might just get trickles of fluid, and that's where it gets confusing. Because as you get later into your pregnancy, especially as you head into those 40 weeks, things are going to get very moist down there. I know you don't like to think about it, but most women end up wearing a pad just because you get increased discharge, just like stuff's going on down there. Sometimes you lose your mucus plug. So you just aren't as sure with some moistness down there as you might be otherwise, like before you got pregnant. A couple ways that you can tell if it's gonna keep coming out. First thing is to stand up. So if you're laying in bed and then you stand up, usually you should get a little gush. Also, if you cough, so if you're just sitting there and you usually a little bit will come out. Now, of course, if you have a very reflexive bladder, a little might come out then too, so it's kind of hard to tell. But one other way that I've seen a lot of patients is when you sit on the bed and you lift up your hips. So in yoga, I think they call that the bridge. If you lift your hips up, somehow I noticed that a lot of people gush fluid at that point. I think just because it's changing the orientation of your pelvis. So that might be a way to tell if more fluid's coming out or not. Of course, if you don't know, definitely call your provider. There is a test that we can do at the hospital. It's called AmniSure. Now, some providers have that test in their office, which would be the easiest way to do it because when you come to the hospital, of course, there are 7 million questions that we need to ask before we can even start the test. But if your provider has it in the office, you can just pop in, see if your water broke. If it did, then you can head to the hospital. If it didn't, you can go home or go to lunch. So that way you just know on your own. I would call your provider just to find out what they recommend that you do. Normally, as long as nothing has come out into your vagina, there is always the chance that the umbilical cord can fall out into the vagina when the water breaks. That is pretty darn rare, so it's just something to be aware of. If you don't feel anything down there and you think your water's broken, there's nothing wrong with, you know, putting a pad on and just kind of walking around and deciding if it's your water broken or not. I will say that most people, when they feel their water break, feel a pop. Now, you might feel a pop and it's just you know, your bladder leaking. And I do have to say that a lot of people come in and say they had a big gush and then it stopped, but they're sure that it's their water. And I have to tell you that most often it's just a little bladder leakage, which is very normal. There is absolutely no one at the hospital that's going to think that that's silly or a reason or something to be concerned about, because as your baby gets bigger, they're kicking that bladder, your bladder just gets more relaxed. So it's not unusual for that big gush of fluid to actually be a little bit of urine. Is it your water broken? It's actually not something you can tell yourself. So it is some reason that you would need to call your provider. If you're still feeling that moistness down there, call your doctor and see what they recommend that you do. A lot of times they'll just have you pop into the office and just kind of give it a check before they send you to the hospital. But sometimes they might just say, go into labor and delivery. It depends on kind of what your story is. A lot of times we can tell stuff over the phone and doctors can give you advice over that type of situations. But at the hospital, we pretty much just have to ttell you to come in due to liability concerns. Let's talk about those tips for moms as you get into the third trimester. What are some things you should kind of keep in mind? Because your water could break at any time. Mine never broke. And in fact, most people's water has to be broken at the hospital because we have nice strong baths, we're eating well and things like that. But I always recommend that people kind of carry a towel around with them. I would probably keep one in my workplace and I would definitely keep one in my car. You can also keep, they call them puppy pads. I see them at Costco, but those are awesome too because you don't have to wash them and you could put them underneath you in your car, your work, things like that. So that if you were to have your water break and you have to drive somewhere, at least you're not getting your seat all wet. So it's an option as well. So if you like this video, I would love it if you would give a thumbs up and subscribe. And while you're down there, I would love it if you could tell me in the comments if you think your water is going to break before you go to the hospital, or if your provider is going to have to break it like most people while you're there. And I think you should check out these next videos because I think you're going to like some of those too.